surrounding the eye, including the eyelids, eyebrow and cheek. And the pathophysiology is results from microbial infection with subsequent inflammation of the post-septal aspect of the eyelids. Most common routes of infection are adjacent sinuses, especially ethmoid sinus or sometimes frontal sinus. It is account for 80 to 85% of cases of orbital cellulitis. Dental infection can also lead to orbital cellulitis via sinuses or directly also. Direct inoculation through the penetrating lead injury also leads to orbital cellulitis. There are many surgeries we do which are also predisposing factor for orbital cellulitis. Includes orbital decompression, DCR surgery, eyelid surgery, strabismus surgery, retinal surgery and intraocular surgery.
In this case, precipitating factor also.
Sir, this was a case of acute and chronic rhinosinusitis with nasal polyposis.
Which secondary infection?
We will come to that. We will come to that. That requires a serious consideration. Person has lost an eye in spite of staying in a 340-bedded hospital center with all facilities of investigation except applying the mind. We've got highly qualified physicians at Kharagpur. We've got ENT surgeons. We have got ophthalmologists visiting there. They have referred the case when the patient had lost his eyesight. It requires a little bit of thinking. Why, with all of us being paid lakhs and lakhs of rupees, a person should lose his eyesight just because of this sort of an infection? There was not timely intervention, absolutely negligence. There's no question.
And there are some few cases from hematogenous spread from bacteremia can lead to orbital cellulitis. Then the commonest organisms include Staphylococcus aureus, Streptococcus pyogenes, Streptococcus pneumoniae, Haemophilus influenza in children. One more thing I want to mention, sir. This orbital cellulitis is most common in early ages, and up to 50% of cases are seen below 6 years of age, and around 80 to 85% cases below the age of 20 years. So, the signs and symptoms include history of upper respiratory tract infection with or without nasal discharge may be present. Sometimes there will be occult sinusitis, which may not be the primary complaint of the patient. Patient comes only with eye complaint, and subsequently it is found that he is having some sinus problem. Swelling and redness of the eyelid and surrounding soft tissues, conjunctival hyperemia, chemosis, decreased ocular motility, pain with eye movements, decreased visual acuity and blindness, proptosis caused by orbital swelling, fever, malaise, headache, should raise suspicion of associated meningitis. Then afferent pupil defect, there may be ophthalmoplegia. The first muscle involved is lateral rectus. So there is an orbital septum which defines the which serves as a barrier for spread of infection from outside of the eye. The orbital periosteum is attached to the lead septum, which forms a barrier. The orbit is separated from the soft tissue of the eyelid by the orbital septum. This is the facial plane that is continuous with the periosteum, the facial bones. The orbital septum inserts into the tarsal plate of the upper and lower eyelids. The orbital septum usually proves to be an effective barrier that prevents the spread of infection from the eyelid posterior to the orbit. While preseptal cellulitis can occasionally spread to the orbit content, it is generally a clinical entity that is distinct from orbital cellulitis.
How much time it takes for this septal capacity or the orbital cellulitis?
सर जनरली जो ऑर्बिटल सेप्टम का इंटीरियर होता है उससे बहुत रेयरली होता है. 80 to 85% cases coming from sinuses, and since there is a very small bony septum, in some cases it is dehiscence, and there is direct venous connection, so chances of phlebitis is there. So if patient's immunity is weak and it is a neglected case, like in this case, patient was always on alcohol and drink, smoking, so he was not taking care of his own health, he was not going to doctor, so it was a neglected case. So chances of getting is very high. And if it is nowadays it's very rare. Earlier it was reported to around 15 to 20% infection when there was not good quality of antibiotics not available. Now it's very rare. So depend on the patient's approach. It may take a matlab it's not we cannot say exactly, depends on patient's approach.
Dr. Verma, when you are
Sir.
pointing one finger at the patient, there are three fingers pointing back at us.
Sir.
Patient may be alcoholic, may be smoker, may be everything, but we have missed out on this for a number of days.
Sir.
We have just missed out on this.
Whether in collection,
हाँ सर कलेक्शन तो था प्रूलेंट स्टाफ तो दिखा है सर so this is a picture of orbital septum.